Hi, everybody. I'm Gwendolyn Sterk of Sterk Family Law, and I have the honor today to have with me Elizabeth House. Hi, Elizabeth. How are you today?
Hi, good. Thanks, Gwen. I'm doing
Hey,
well.
can you tell us a little bit about yourself?
Sure. So I'm a clinical mental health counselor with a private practice in Naperville, Illinois called Hopeful Changes. I was previously a teacher for 14 years. I've also taught internationally. I've taught college. I kind of ended up stumbling upon therapy as my retirement job, let's call it. And I have lots of experience with like children and adolescents as well as adults. So those are some of the services that our private practice offers. Right now, I'm doing individual therapy at that location.
Well, very good. One of the things that we want to address today is one of your areas of concentration, which is eating disorders in children. And it's something you hear about for a while, and then it seems to go out. Years ago, you heard a lot about it. It still exists. It's still a major issue. So I really want to start today with a conversation about, can you tell us what are the types of eating disorders in children?
Sure. So, eating disorders are actually complex medical and psychiatric illnesses that clients don't choose and parents don't cause. I think a lot of parents struggle with that component of, like it being something they've done or not done. The American Psychiatric Association classifies 5 different types of eating disorders according to the Diagnostic and Statistical Manual, the fifth edition, which we call the DSM-5. Those are anorexia nervosa, bulimia nervosa, binge eating disorders, avoidant restrictive food intake disorder, and other specified feeding and eating disorders. Several decades of genetic research show that biological factors can play a significant role in who develops an eating disorder. Eating disorders are often clinically referred to as EDs. EDs are also commonly co-occurring with other mental health conditions such as major depression, anxiety, social phobia, and obsessive compulsive disorder. When researchers examined things like death rates of individuals with eating disorders who had the diagnosis being treated as outpatients, they found roughly like 1 in 20 people with eating disorders die as a result of the illness. Individuals who abuse laxatives or diuretics or force themselves to vomit are at significantly higher risk of sudden death from things like heart attack due to electrolyte imbalances. Excessive exercise also can increase this risk of death in individuals with eating disorders by increasing the amount of stress that it puts on the body. Although our current culture is kind of highly obsessed with food and weight, and distorted patterns of eating are very common, clinical eating disorders are less so. There was a 2007 study that asked 9,282 English-speaking Americans about a variety of mental health conditions, and it roughly found that 0.9% of women and 0.3% of men had anorexia sometime in their life, whereas 1.5% of women and 0.5% of men had bulimia. But the highest rate was binge eating disorders, which is the most common, and that was 3.5% of women and 2% of the male population. So the consequences of eating disorders can be life threatening, and many individuals find stigma against the mental illness, especially with eating disorders. It's one of the more stigmatized categories, and that can obstruct the timely diagnosis and adequate treatment.
Okay. It sounds like there's just so much material out there. So you mentioned 5, you've gone into some statistics. So, you've got a parent out there who is saying to all of us, I don't even know where to start. I don't know what's causing this. I don't know what the triggers are. You're saying it's biological, but it also has a component of mental health with it. So if a parent's listening today and they want to say to you, okay, Elizabeth, tell me what's triggering this or what could be causing this at this point in time to come up in the situation?
Sure. So there's no simple answer to that question. The causes of eating disorders are very complex. Current thinking by eating disorder researchers and clinical experts hold that eating disorders are caused by both genetic and environmental factors. So they are considered biosocial culture diseases. A societal factor, for example, like media driven thin body ideals, is an example of that. An example of something that is more of like an environmental trigger can be linked to an increased risk of developing an eating disorder as well. So, environmental factors also include physical illness, childhood teasing and bullying, and other life stressors such as a parent's divorce.
Sure, absolutely. It can be a trigger. And those are the things. So I think it's real interesting because I think some parents want it not to be a mental health issue, but then some people think it's a mental health issue and not a biological issue, but it's a real unique illness because it's a combination of both. So treating it must be, somewhat difficult. But
Absolutely.
going on, you got a parent, so they say, okay, I understand now this could have been what triggered the event, but I'm not sure that it is an eating disorder. How can parents start looking at recognizing, you know, an eating disorder, or at least seeing signs to say, I need to get help for my child?
Sure. So that's complicated too, of course, like many things that are mental health, because many eating disorder sufferers go out of their way to hide the symptoms of their illness. They're hiding it either out of shame or because they're afraid someone will make them stop. It's not uncommon for loved ones to be caught off guard at how severe or pervasive the eating disorder behaviors are when a diagnosis is made, or when people close to the sufferer become aware of that they're struggling in general. If you are aware of a loved one struggling with it, it's important to express concern with empathy and compassion, and then encouraging that individual seek help. There's tons of organizations from all around the world, including the Academy of Eating Disorders, the American Psychiatric Association, and NEDA, that have published guidelines that indicate that parents don't cause them. And I think that guilt factor is really where parents struggle the most, especially mothers. That was traditionally one of the areas that were blamed for children's eating disorders, but more recent research supports that eating disorders have a strong biological root, and they develop differently for each person that's affected. And there's no set single set of rules that parents can follow to guarantee prevention.
So I understand there's a sign out there, or there may not be a sign because it's really easy to hide. You have a parent that says, okay, there was a triggering event. I'm suspicious that there's an eating disorder.
Mhm.
So what should they do next to start? I mean, where a lot of people feel paralyzed every time a new issue arises. So where do you start?
Sure. So there's lots of places you can start. I always am a firm believer in kind of wraparound approaches in general. Eating disorder treatment, there are many players that make that process go well. So it depends on which eating disorder it is, but even within all of them, I would say definitely consulting an MD, like the pediatrician, making them aware of concerns, making sure that weight is being managed as well, because the medical care is necessary for things like dehydration, low blood glucose levels, anemia, low blood pressure, things like that, that can really create long term problems like osteoporosis and abdominal distress. Um, but then also consulting, definitely, like a dietitian, a mental health clinician, as well as a psychiatrist in some circumstances, to make sure that if medication is needed, that is medically managed, as well as like that wraparound approach.
Right,
As
because
far
it seems like it takes a village to treat this. You've got the medical, you've got the dietitian working, and then you've got the mental health provider. Is there interaction between all those experts to try to help a child move forward then?
Yeah, in the ideal world, that definitely is the best approach, right? Because then everybody's kind of holding everybody else accountable. If it's something more extreme, there's also different levels of care too. As far as like residential, they have 30 to 90-day programs. They have partial hospitalizations where you would go from like 8 to 6 and have lots of classes throughout the week
Sure.
and throughout the day, and everything from music therapy to individual and group. And then there's also intensive outpatient programs, and that can be like 3 to 5 days a week, with less hours, from like 3 to 4 hours a day in the evenings or in the afternoon as well.
Got it.
Um,
Okay, so here I am, I'm a parent, and I'm thinking, okay, I've identified a problem. I've spoken to the doctor about my concerns, but the doctor can't get any information out of my child because my child's also in denial. So, everything's fine. It's all okay. There are no issues. What does a parent do then?
Sure. I think support, right? So there's different organizations that parents can gain education from as well. My personal favorite, and it's not that there aren't other great organizations, but the National Association of Anorexia Nervosa and Associating Disorders is a nonprofit that offers all sorts of like wraparound supports as well. They offer free. There's a helpline. There's free support groups for people that struggle with eating disorders. They're virtual right now nationally, so they're pretty easy to get into at this time. But they also have everything from treatment directories to peer mentors. And that kind of helps parents have a place to start, because that denial piece can be very, very strong for both the patient and the parent.
Right. I mean, it's one way or another. There seems to be a denial both sides, but I can understand that some parents really have a difficulty in getting their child to go. Now, what if they say, okay, I don't want to go online to a national organization. I don't really want to talk to my doctor. I want to go to a new place. Could they go to a therapist and start there to try to get an acknowledgement of a problem and then get the the involvement of the other experts to do that wraparound approach?
Absolutely. I think having a therapeutic alliance in any situation is always better, right? So it depends on the severity. I would say that there's obviously this is a large scale. If somebody's to the point where they need feeding tubes, that looks quite different than somebody who's purging once a week, right? So I'd hate to make a blanket statement where yes, do that first. I personally would always reach out to a medical practitioner first, just to make sure that the safety elements of it are taken care of. If a child is more resistant and they start seeing an outpatient therapist like myself even weekly and have that therapeutic alliance of, hey, let's really like talk about what thoughts are going into this, right? Because of course they're related. People's elements of self-worth, people's thoughts and beliefs that we create around the events of our lives that aren't necessarily true. I always tell people you can't believe everything you think.
Right.
um, so yes, definitely. I think it depends on the person and whatever makes that family successful to meet the child or adult's needs, depending on their situation, is what is best for them.
As a divorce practitioner, I think that you hit really on an important point that, those environmental factors can trigger something that's biological. And I've seen that. I've been practicing family law for 32 years. And if I look back and I say to myself, maybe that situation arose because of X or because of Y, and it was maybe there anyway, and it was going to come out and blossom anyway. I think sometimes people want to hide, they want to pick up the carpet in the corner of the room, put these crumbs underneath, and think that the problems are going to go away. And I think the message that you're really sending to everybody is you got to deal with it, you got to confront it, and you got to move forward and figure out a plan to go forward with your life.
Absolutely. And I think meeting any mental health need is that first step, right? So as long as again medically someone is safe, there's a real important element of making sure that having the lowered symptomology is addressed too, because if somebody's anxiety, for example, is on fire and you tell them to do something that creates more anxiety, that's going to be difficult and crippling for that person in general. So if
Well,
they
tell the
have
listeners out there today how they can get a hold of you to try to move forward and say, hey, I really would like to have a consultation with you. I'd like to learn some more. I heard the lecture today. I think we have a family situation we need to deal with. So give us your information.
Sure. So I'm with Hopeful Changes. We're off of 1300 Iroquois Avenue. Our suite number is 220A in Naperville. The zip code is 60563. My direct email is ehousehopefulchanges@gmail.com. And my direct line with the practice is 331-305-4055.
Sure. And just if they're looking for information and they want a place to get started, I would encourage them to give you a call because you can do this at an initial meeting and figure out a plan for the future. Am I correct in that?
Absolutely. So the first step with any mental health provider usually is what we call an intake. So it's kind of an interview to gather just all medical and mental health history, and then to also gather information on presenting symptoms to create a diagnosis. Then once a diagnosis is created, a treatment plan based on what the clinician is seeing as well as what the patient or the client identifies as their treatment goals. And that's kind of where it begins. And then you go from there.
Right. And then you can put those wraparound services in from there. Well, it's
Absolutely.
very good to talk to you. I know that this is an issue that's hard for people to talk to, but it's good to have some of these statistics. And I think that people are not alone out there. This is a situation that exists, and it's nice to see that you really have an area of concentration in this. So thank you for your time today. We really appreciate it.
Happy to help. I'm happy to help. Thanks for having me.
Thank you.
Sure.